Hello, dear friends. Welcome. Today, we have a patient. Her name is Valeria. She came in with scoliosis and pain in the thoracic and lumbar areas. In general, there's noticeable discomfort in the lower back. Valeria works as a pharmacist, and it's a standing job, meaning she spends most of her day on her feet. Thankfully, no night shifts. Now, let's move on to the examination. After that, we'll proceed with a warming massage and immune therapy. But first, the initial assessment. Visually, we can already observe vertebral rotation. I'm not sure if the camera will pick it up clearly, but from the side angle, the right side of her back is more rotated. Rotation is one of the hardest issues to correct. It takes more time to treat than other misalignments. Let's relax. Deep breath in and out. On palpation, the area feels quite unpleasant to the touch, especially the mid and lower back. Everything is tight, almost stone-like. If the camera shows it well, the angle on one side is much sharper than on the other. That's a clear indication of asymmetry. All right, we're moving to the table for further examination in a lying position. After that, we'll do a warming massage and salon therapy. Lie face down on the table. Now, let's proceed. Deep breath and relax. We can immediately notice a slight thoracic kyphosis. Palpating the quadratus lumborum muscle on one side causes pain, while the other side feels just a bit uncomfortable. No sharp pain, but still not normal. These muscles are tight due to kyphosis. Let's move on to the massage. We're warming up the tissues properly, working through the quadratus and rhomboid muscles as needed. As usual, we'll start with the lower back. Valeria needs to relax. Relaxation is key. We start with one side, then move to the other. The main idea is not pressure, but stretching, elongation of the tissues. If you hear cracking or clicking sounds, don't worry. In some areas it's expected because we're initiating those movements. For example, the lateral cervical areas shouldn't normally crack if they're healthy. We'll use a slightly different approach now. Let's have her sit in the center of the table, facing away. Leaning back just a bit more. Yes. Legs apart so we have access to both sides. I'll demonstrate a partial lotus position for better alignment. Now the torso leans slightly. Good. Stay relaxed. Most people don't even know that this kind of mobilization is possible. From here, we lie back, arms crossed. Right arm over left. Then we roll onto the left side and sit up again. No signs of dizziness, which is great. Now we move into a position where hands are clasped behind the head. And from here, we initiate spinal stretch. That stretch indicates kyphosis is present. Now the head goes down, shoulders curl inward, and we lie back. Then return to a seated position, back on air. Here's an interesting detail. Do you know why people instinctively cross one leg over the other in a certain way? Try switching it. One side feels more natural, right? That's because of vertebral rotation. The body is clever. It compensates in subtle ways we don't even notice. If it reacted visibly to every small imbalance, life would be a lot more complicated. Now we're ready for spinal decompression. Stretching begins. Relax. The response is positive. Everything feels fine. If the camera can be lifted a bit, you'll also see the rotation from the front. Rib asymmetry is clearly visible from this angle. From this view, you can see the left side of the rib cage is slightly elevated. It's noticeable, and that reinforces our diagnosis. Head is clear, no pain, no heaviness. That's a good sign. Legs are being relaxed for full body release. We're continuing the stretch. Just a little more. Perfect. Now we'll switch position again, lying on the stomach, supported by the elbows. Elbows together, slight lean forward, eyes looking ahead. Usually, if there's an enhanced thoracic kyphosis, it's often accompanied by a pronounced lumbar lordosis. Time to rise up again. She turns sideways to me, and we perform a light spinal release. There it is, unexpected, but effective. Sometimes you feel a pop. Sometimes it causes slight pain. But this is normal in therapy. We wrap up while the body is still warm. Honestly, this kind of session could be streamed live. It's that revealing. This was Valeria's first experience with a therapy like this. She didn't even know what to call it. Some parts were quite uncomfortable. The warming massage, in particular, was intense, almost unbearable. Muscles were in high tension, hence the challenge. But after the release, especially following the spinal adjustments, there was a sense of relief and even pleasure. I worked up a sweat myself. But now, the most important part. How does the body feel? She reported a clear sense of lightness in the lower back. That's a great outcome. The head still feels slightly floaty, which is expected after such a release. That velvet sensation means the body is adjusting. If that happens, you should always take a break and rest. She'll sit down for a while now. I've recommended an ultrasound of the cervical vessels to check the blood flow in the neck. It's important to understand whether the reaction was caused by poor circulation or a previously blocked area that was just released. Both possibilities exist. Once blood flow is restored, the brain can react as if it's been shocked by the sudden oxygenation. But the important thing is, it's now easier to breathe, easier to think. There was a bit of dizziness, but it's completely within the norm. I've given all necessary recommendations. Once we check the cervical blood flow, we'll know more. This kind of response is typical when we remove a block. The area decompresses, blood flows freely, and the brain feels that velvet. That's it for today. Thanks for watching, friends. Make sure to subscribe to the channel, leave a like or a dislike, and see you in the next session.